Hello everyone, welcome back to Med Insights with Rahul. Today we are diving into the topic that is tiny and mighty, that is kidney stones.
Yep, these little troublemakers can turn the toughest people into the balls of tears.
But don't worry, we are going to have some fun while learning about these pesky pebbles. Ready? Let's get rolling. Before we get started, make sure you hit the like button and subscribe for more fun medical insights. Alright, let's dive in.
So, what exactly are kidney stones? Imagine your kidneys are like water filter, keeping things clean and healthy inside your body. But sometimes instead of just doing their job, they decide to start a rock collection. And these rocks, they are called kidney stones. Kidney stones form when certain things in your pee, like minerals or salt, start sticking together. Think of it like making rock candy, except instead of something sweet, it's more like biting into a rock.
But hey, at least it's free, right? These stones are as small as the grain of sand and as big as the golf ball. But trust me, size doesn't matter when it comes to the pain they cause. Now, how do you know if you have a kidney stone? The biggest sign is pain. The pain is sharp, sudden and super intense. It usually hits your back or sides and it feels like someone is squeezing your kidneys like a stressed ball. And when you feel like you have been hit in the back by the Hulk, and that's the first clue.
Other symptoms include feeling sick to your stomach, vomiting, and my personal favorite, peeing out what feels like broken glass. Yes, it's as bad as it sounds.
You might also see the blood in your urine and feel the constant need to go, even if nothing comes out. It's like your bladder is playing tricks on you and saying, oh, you need to pee. Just kidding, there is nothing there.
So what makes these little troublemakers? It's usually a mix of things like not drinking enough water, eating too much salt, or just plain bad luck. Sometimes your body just decides, hey, let's make a stone. Certain foods can also lead to stones. Foods like spinach, nuts, and even chocolate can be troublemakers. Yeah, I know chocolate. Life can be so unfair, right?
You are also more likely to have kidney stones if any of your family member had them, like your mom, dad, or even your grandpa had the kidney stone. You might be next in the line for the family rock collection. Thanks, genetics.
Okay, you got a kidney stone. What now? First thing first, drink ton of water. Not just a glass, but enough to turn the stone into a swimmer and enough to drown a small village.
Water helps to push the stone through urinary system. It's the body's way of saying you are not welcome here, stone. And for the smaller stones, drinking lots of water might do the trick.
But if the stone is too big, doctors might need to step in. They can use something called shock wave therapy, which is like sending sound waves to break up the stone into tiny pieces. It's a kind of like smashing a rock with a hammer, only much more high-tech and inside your body. Doctors might have to go all James Bond on it, using sound waves to blast it into tiny pieces. And if that doesn't work, surgery might be needed. Don't worry, you don't feel a thing during the surgery, and the stone will be gone for the good.
Now let's talk about the prevention. How do you stop the stones from forming in the first place? The key is simple. Drink plenty of water, have balanced diet, and don't go crazy with the salt.
Water keeps everything flowing smoothly, so those minerals don't have time to stick together. Aim for at least 8 glasses a day, or more if you are sweating a lot. It's like giving your kidneys a bath, but from the inside.
When it comes to the food, just remember everything in moderation. You don't want to give your kidneys another idea of starting a new rock collection.
Also be mindful of your sodium intake. Too much salt can lead to stones, so try to limit processed foods and salty snacks. Your kidneys will thank you.
So that's everything you need to know about kidney stones. Remember, take care of your kidneys and they will take care of you. If you liked the video, please like, share and subscribe the video. Thanks for watching Med Insights with Rahul. Stay hydrated, stay healthy and see you in the next one.